Hey guys, Oscar here with Gastroenterology Simplified, and I hope you're having an amazing day today. Today we're going to talk about the most common symptom that a patient presents to the hospital with, to the ER, when it comes to gastroenterology. The most common symptom is abdominal pain. The patient could be experiencing epigastric abdominal pain, right upper quadrant abdominal pain, left upper quadrant abdominal pain, right lower quadrant abdominal pain, and or left lower quadrant abdominal pain. Depending on the type of pain that the patient is experiencing, then you have to go ahead and get a good history. You need to make sure that you get a good history because this is the key. The patient pretty much will give you the answer if you get a good history. Now your job as a provider, as a new physician assistant, nurse practitioner, or a new medical doctor, your job is to confirm the diagnosis. How are you going to do that? Well, you're going to get a very good history because that is the key. They'll give you the answer, the patient will. Then you're going to get some labs depending on the diagnosis that you suspect. Then you're also going to proceed with a radiological study depending on your suspicion. I'm going to give you some samples here. For example, let's say the patient is experiencing right upper quadrant abdominal pain. So you suspect acute cholecystitis. Then you're going to go ahead and get an ultrasound of the right upper quadrant. And if needed, you're going to go ahead and get a CT of the abdomen and pelvis. When you get a CT of the abdomen and pelvis, it is ideal to get it with IV contrast, if possible, of course, if the patient's kidney can't tolerate it. Let's say the patient has severe epigastric abdominal pain and you suspect acute pancreatitis. Then you need an ultrasound of the right upper quadrant because the patient could be experiencing gallstone-induced pancreatitis. But also getting a history will let you know if the patient has alcohol-induced pancreatitis. So that is the key. So you get the ultrasound of the right upper quadrant, and if needed, you may also need a CT of the abdomen and pelvis with contrast because you need to assess for acute pancreatitis and any complications that this may bring. Let's say the patient is experiencing symptoms consistent with right lower quadrant abdominal pain, which could be secondary to acute appendicitis. Then you should get an ultrasound of the right lower quadrant and, if needed, a CT of the abdomen and pelvis with contrast, of course. I'm going to go ahead and throw two more here. If a patient presents with severe left lower quadrant abdominal pain, some fevers, elevation in white blood cell count, then you could, or you may think that the patient could be experiencing acute diverticulitis, which is an infection of the colon. Just keep this in mind. Acute diverticulitis is an acute event where the itis at the end of the word means an inflammation or infection. Now, diverticulosis is a diagnosis that you carry pretty much for the rest of your life. And acute diverticulitis is when that part or the pocket of the colon is inflamed or is infected. So if you suspect that, you need to get a CT of the abdomen and pelvis with IV contrast, if possible, to assess for acute diverticulitis, diverticular abscess, and so on. Let's say the patient presents with painful blood per rectum, meaning abdominal pain and blood per rectum. And the patient could have had experienced a recent drop in their blood pressure. The patient could be experiencing ischemic colitis. If you suspect the patient is experiencing ischemic colitis, then you should go ahead and obtain a CT of the abdomen and pelvis. Once you confirm that and the patient is hemodynamically stable, then you're going to proceed with a colonoscopy. So, the most common diagnosis that a patient presents to the hospital with specifically the ER, when it comes to gastroenterology base or focus on gastroenterology, is abdominal pain. Abdominal pain could be many things. Just to throw a few, it could be acute pancreatitis, gastric ulcer, cholecystitis, gallstone-induced pancreatitis, alcoholic pancreatitis, acute appendicitis, diverticulitis, ischemic colitis, bowel obstruction, ileus, bowel perforation, and so on, just to name a few. Your job as a new medical provider or as a medical provider is to confirm the diagnosis and then proceed with management. In conclusion here, the key is to get a good history from the patient, because 80% of the times, the patient will give you the answer. Your job is to confirm it. I hope this video was helpful. If you like this video, or if you like this type of video, please click like, subscribe so I can bring you more videos like this. And remember, the videos here are for education only, and I'm a board certified physician assistant, but I'm not your physician assistant. I hope you have an amazing day, and I'll see you in the next one. Bye.